Hi everyone. I'm Carolyn Moneymaker, and I'm the chairperson of the steering committee of Immunize Virginia. Before we get to the substance of the meeting today, Rebecca Epstein, our executive director, has a few housekeeping duties to report.
Good morning, and thank you, Carolyn. Welcome, everybody, to our first annual meeting. We're so excited to have you here. As Carolyn said, before we get started, I have just a few housekeeping notes to help you enjoy your experience here on this platform today. I first wanted to note that after each presentation, there will be a pause in the broadcast as we transition to speakers. So don't be alarmed if you see the broadcast stop. We will always have all presentations here on the stage. And again, just expect that brief pause while we transition speakers, get new screens set up. This is a live stream, so please feel free to use the chat to connect with other audience members, other coalition members, and to ask questions of our different presenters. We will have staff at all time also monitoring the chat. So if you have any technical concerns, please don't hesitate to reach out to my colleague, Katie. She'll be in the chat again at all times. This is a very interactive virtual space as well. On breaks, you will be able to network with other attendees and coalition members. On the left-hand side of your screen, there's a toolbar with a space that says networking. On our breaks, you can go there and like speed networking, get paired with somebody else who's in the room and have around 2 minutes to chat. If you would like to connect with someone directly, on the right-hand side of your screen, you'll see a tab that says People. You can click on anyone's name and send them a direct message or request to meet with them during the breaks. We also have 2 continuing education credits available for nurses, physicians, and pharmacists. And with that, I'm going to share a few disclosures. In support of improving patient care, this activity has been planned and implemented by ImmunizeVA in VCU Health Continuing Education. VCU Health Continuing Education is jointly accredited by the Accreditation Council for Continuing Medical Education, the Accreditation Council for Pharmacy Education, and the American Nurses Credentialing Center to provide continuing education for the healthcare team. VCU Health Continuing Education designates this live activity for a maximum of 2 AMA PRA Category 1 credits. Physicians should claim only the credit commensurate with the extent of their participation in the activity. To receive these credits, you must complete a verification of participation form and an evaluation. These documents will be distributed via email after the meeting. We have no disclosures or conflicts of interest to share, and no acknowledgement of commercial or in-kind support that was provided for this activity. And with this disclosures, I'll turn it back to you, Carolyn.
All right, thank you. You see on the screen tracker, she will be listening in today. She hadn't learned to use the chat yet, so if you hear barking in the background, she is trying to get her opinion across. So, welcome to Immunize Virginia's first annual meeting. This event is designed to be educational and informative, but we also want to honor and celebrate the hard work that all of us in this coalition have been doing for the past year. And it's been a very trying year, as everybody on this broadcast knows. We're also celebrating the coalition's 1-year anniversary, and we have grown to a coalition of over 350 members across the Commonwealth. 150 members. See, I have delusions of grandeur. 150 members across the Commonwealth, representing 84 unique organizations. And let me just brag a little bit here in what we've done this year. We've provided education and awareness on policies that would improve immunization rates in Virginia. We've piloted collaborative community-based vaccination clinics for the flu vaccine. We've developed and facilitated trainings for community health workers, outreach workers, and community champions on the influenza and COVID-19 vaccines. hosted numerous educational presentations and webinars on pertinent vaccination topics like vaccine communication strategies. We've published updates to vaccine recommendations and given vaccine-specific recommendations. We've launched a widespread communications campaign centered on community voices and stories to promote routine and COVID vaccines. We have supported our members in publishing 3 op-eds for major newspapers in the state, and we've disseminated a survey on healthcare providers' attitudes surrounding the COVID-19 vaccination and the VIZ user experience. VIZ is the immunization information system for the state, as all of you know. We have successfully petitioned our governor, Ralph Northam, to declare August Immunization Awareness Month 2 years in a row, and we've developed successful communication strategies. And last but not least, we have introduced our beloved mascot tracker and hosted a tracker themed coloring contest. And as I said, as we go through the winter and spring, hang on for more tracker sightings. So none of this would have been possible without dedicated members like all of you out there, and to our wonderful staff, Rebecca Epstein and her staff at IPHI. And I want to just send out a major kudo to her. So thank you for all of you have done for the coalition, and more importantly, to keep your community safe during one of the most difficult and frankly frightening times in our nation's history. And we have a wonderful lineup of speakers today that includes Dr. Carey, Virginia Secretary of Health and Human Services, Dr. Paul Offit, Director of the Vaccine Education Center, and who is an internationally recognized expert in immunology and virology and is an all-around great pediatrician. Christy Gray is our Director of Division of the Immunizations at VDH and is a key partner in this coalition. And I've had so much pleasure working with her and her staff. We have Karen Ernst, who's the program director at Voices for Vaccines, an organization that has supported us in numerous ways during our first year. And last but not least is our very own Mike Royster, who's a senior vice president of the Institute for Public Health Innovation, IPHI. He is a leader on the forefront of health equity in Virginia. And we also will present the first annual award for outstanding contribution to immunization advocacy. Now, one thing to remember, so you can just relax and listen and not feel like you have to take notes or anything like that. All presentations will be recorded. And remember, in between each presentation, there will be a momentary pause while the staff set up the next presentation. And thank you all for everything you do for us and we do for each other to keep us safe. And we look forward to a great meeting. Remember, use the chat. Thank you.
Thank you so much, Carolyn. So we'll pause the broadcast now and we will resume in just a few minutes. Thank you.